Heather Campbell, HeaTherCampbell. The patient's vitals are as follows. Her heart rate is 105 beats per minute, which is normal. She's experiencing tachycardia. That could be due to anxiety, shock, or exercise induced, which may indicate a need for increased cardiac output. The patient's respirations are 20, which is normal. Her blood pressure is 167/100, which is abnormal. She's experiencing stage 2 hypertension, which can cause cardiovascular disease. Her temperature is 37, which is normal. Now I'm going to ask the patient some questions related to cardio, GI, and history. Do you have any shortness of breath?
I don't think so.
Do you have any pain or tightness in your chest?
I have an ache in my upper chest.
Do you have any dizziness or vertigo?
I just feel tired.
Do you have any edema?
No.
How is your appetite?
It is good.
Do you have any pain in your abdomen?
I have a stomach ache.
Do you have any nausea or vomiting?
I'm nauseous and I vomited once.
How are your bowel habits?
Normal.
I would complete an OPQTRSU. Now I'm going to inspect the cardio and the GI. I'm looking at the patient. She looks unwell. She's diaphoretic. She has no abnormal veins, no edema, no obvious JVD or increased work of breathing. She's behaving appropriately. She has no dyspnea with talking. Her color is consistent with her ethnicity, no cyanosis, no pallor. There's no pulsations noted. On inspecting her abdomen, there's no pallor, there's no bruising, there's no lesions, scars, rashes, or striae. Her abdomen is rounded. Now I'm going to palpate her pulse sites, starting at her carotid, her brachial, her radial, her femoral, and her dorsal pediis. I'm going to check her cap refill, which is normal. Now I'm going to auscultate for heart sounds, murmurs, or breeze with the bell of my stethoscope. I'm starting in the aortic, which is the second intercostal space right of the sternal border. Now I'm going to the pulmonic, which is the second intercostal space left of the sternal border. Now I'm going down to Erb's point, which is the third intercostal space left of the sternal border. And now I'm going to the tricuspid, which is the fourth intercostal space left of the sternal border. Now I'm going to the mitral, which is a fifth intercostal space left of the sternal border. I would repeat for any murmurs, and murmurs may sound like an added sound, like a whoosh, rasp, or a hum. I would auscultate the apical pulse for 1 full minute, which is the fifth intercostal space left of the midclavicular line, and this is done to assess if the patient has an abnormal heartbeat, and it should be done prior to administering digoxin. And now I'm going to auscultate for bell sounds with the diaphragm of my stethoscope. I'm starting in the right lower quadrant where the appendix is. Now I'm going to the right upper quadrant where the liver is. And now I'm going to the left upper quadrant where the stomach is, and the left lower quadrant where the descending colon is. If there was no bowel sounds, I would listen for a full 5 minutes. Now I'm going to palpate the patient's abdomen using 3 to 4 fingers, going in a circular motion, 1 to 2 centimeters depression. I would start in the quadrant furthest from pain, and if there's no pain, I would start in the right lower quadrant. I'm going to cover all 4 quadrants. So for this situation, this is Janet Marco. She's a 63-year-old female who's complaining of shoulder pain, stomach pain, and upper gastric pain. The background is she is having pain in her shoulder, in her abdomen. She has no cyanosis, no increased work of breathing. She just feels tired. My assessment is the patient is unwell. She's diaphoretic. She has no abnormal veins, no edema, no JVD or increased work of breathing. My recommendation is that the patient will see the physician for further assessment. She is being provided a bed to rest in for comfort measures. What I think could be going on with the patient is that she's having a myocardial infarction and MI because her symptoms have not improved with rest. 2 nursing interventions, and one related to the vitals would be to administer nitroglycerin sublingually, which should help with her chest pain, elevated heart rate and blood pressure. And the other one would be to obtain an EKG and perform blood work to obtain her troponin levels to confirm if in fact she did have an MI. Thank you.